If I have a black female surgeon, my first assumption will be this person had to meet lower standards.
If this is not racism, I do not know what else it is. I feel like this is racism and this is also sexism because it does not like women. There are some people that cannot stand that a woman is on top. They cannot stand the fact that you are leading as a woman. It hurts them so much. They cannot, like, they always want to, when they see a woman winning, they feel like, oh, she slept her way to the top. Oh no, she cannot afford all of that. It's a man that is a man. Like, there's nothing. A man gets her to that position. They do not want to believe that a woman can actually do that by herself. I have few reaction on this video, but then I'd like to know your thoughts about this video down in the comment section respectfully. Let me write some videos for you all to watch, the reaction on people talking about this particular topic, then we'll come back and talk about it.
If I have a black female surgeon, my first assumption will be this person had to meet lower standards because the school or the certifying board was so anxious to say we have a black female surgeon. And of course it's unfair to the individual, but then the whole system is unfair. So should you be shocked that it produces unfair results? No. I mean, it's unfair.
It is unfair, down on the face of it and in practice and every other possible way.
Yes. If I have a black female surgeon, my first assumption will be this person had to meet.
You know what I hate to see is people thinking like this, and I fear that a lot of people in the college sense also have this kind of same idea, and especially that I don't deserve to be here and that I was just a DEI hire, when that truly simply is not the fact, when I'm just as qualified, if not way more qualified than these people who parents donate money to TCU, or that their legacy admissions, like what? Make it make sense. I also think that people saying this type of thing, like say like about professionals, or even about like Kamala Harris, that she was just a DEI hire, think that it doesn't affect like me, or you know how I know that they perceive me as well. But you know, when they're saying this kind of things, it's like I already have an understanding of how you view me and where I'm at.
If I have a black female surgeon, my first assumption will be this person had to meet lower standards because the school or the certifying board was so anxious to say we have a black female surgeon. And of course it's unfair to the individual, but then the whole system is unfair. So should you be shocked that it produces unfair results? No. I mean, it's unfair.
It is unfair, down on the face of it and in practice and every other possible way.
Yes. I have a black female surgeon, my first assumption will be this person had to meet lower.
So I'm not gonna lie, I've kind of gotten to the point where I honestly think that the right does this as rage bait, because there's no way that somebody could possibly have a brain and draw this conclusion. Like, I don't think it's possible, because it takes 2 seconds to really think for a moment. And it really, once you do that and you think, you would know that every single student who gets into medical school, they have to take a standardized test known as the MCATs. So it doesn't matter what your race or your ethnicity is. It doesn't matter where you come from. If you can pass the MCATs, you get into medical school. That same logic applies to getting your medical license. Every single person, regardless of race, ethnicity, gender, it doesn't matter what you look like, who you are. If you can pass the United States medical licensing exam, then you get your license. You are a doctor. So a black female doctor has the exact same credentials as a white male doctor. So there's no lower standards for women or for black people or people. There's no lower standards. This narrative for DEI baffles me, because if a asswipe like him was sitting in an admissions office at a college or at a university and he saw her application come by, he would literally swipe right past it because she's a woman and she's black, because it's not about lower standards. It's about him being racist and sexist, and he just proved it with that video. And that's why DEI initiatives are so important, because asswipes like him have a bias and will literally overlook a black female applicant because of this logic, even though the logic is baseless. There is no evidence to suggest that he would be in more danger with a black female doctor. In fact, if we're looking at statistics, which we all know the right doesn't like to do, but if we look at statistics, you would see by the statistics that you are more likely to survive, right? The mortality rate is lower with female doctors. The readmission rate is lower with female doctors. So if you're in the hospital, not only do you have a lower chance of dying, but you also have a greater successful outcome by being treated by a female doctor, because the chances that you will go back to the hospital and be readmitted is lower. For so many years, the history of gynecology and the field of gynecology has been horrific and horrible, and that is because it was founded by men, none other than men. And the research and the information has been so outdated, and we've been so behind on medical information because of men, that now those fields like gynecology, fields like pediatrics, fields like dermatology, all of these fields have been increasingly growing a female population, and we've been seeing more and more successful outcomes because these fields are becoming more female dominated. Like, to the point that there's research showing that Black infants are more cared for and there's greater successful outcomes when they are treated by Black doctors. Like, if that doesn't tell you that there is bias and there's racism and even sexism in the field itself, but then even in the universities and even in society, which is why it is so important to have representation in these offices, in doctors' offices. There needs to be more Black doctors. There needs to be more female doctors, because the white men are not cutting it. Therefore, if statistics are showing us that being cared for by a female doctor and a woman of color is a greater chance at survival and a greater chance at success with your health, and you completely bypass that altogether, and we know that every single doctor, regardless of race or ethnicity, has to pass the exact same test and have the exact same credentials, and we know that women and Black female doctors especially don't face lower standards, they just face more scrutiny by assholes like you. Well, none of what you're saying tells us anything about the doctor. It tells us everything about you, and that everything is that you are racist and sexist, but we already knew that.
A Black female surgeon, my first assumption will be this person had to meet lower standards because the school or the certifying board was so anxious to say we have a Black female.
So I think we all are aware that Tucker Carlson is a raging racist. And the idea that you would see a Black female doctor and automatically your brain would say, oh, they had to lower the standards for her to get in here is crazy. I want someone to name one system, one company, just anything in America that they have said, you know what? We're going to make it easier for Black people. The only thing they've ever made it easier for Black people to get into is prison. That is it. That is quite literally the only thing in this country they have made it easier for Black people to get into and never get out of. They went on to say some more things, so I'm going to add that clip right here.
You're counting on, as a patient, reason. You want a fact-based, logical physician, or else you could die. And so anyone who accepts clearly illogical, unreasonable suppositions and doesn't push back against them is basically involved in witchcraft. Right? So if I can say to you something that is provably untrue and just on its face stupid, which is, a Black female patient needs a Black female doctor, it's like, what are you even saying? Show me the evidence. There is no evidence. It's crazy on its face. It's Nazi stuff. If you go along with that, then you've disqualified yourself because you're not a rational person. You're a witchcraft practitioner. So that just freaking.
So when I was pregnant with my first daughter, I had horrible hip pain. When I say horrible, to the point I could not walk. I could not walk. My ex-husband had to leave work early to come home to get me out of the bed to carry me to the bathroom. I went to my white old doctor and told him, I am in so much pain, I cannot walk. He said, you need to keep moving. He refused to put me on bed rest. I used every single leave day I had. When I went into labor, I was in the hole. So some days I could walk and some days I couldn't. So on the days I couldn't walk, I had to use my leave days because the command I was at, they weren't going to just let me stay home without documentation from my doctor. And my doctor refused to put me on bed rest, even though I could not walk. To the point where now my daughter is 5 years old and I still, matter of fact, I'm feeling hip pain right now. right now as I'm talking to you. There are some days right now, 5 years later, that I cannot walk, that I have issues walking. I've been to physical therapy and everything. And this is something, so also, I know Black women who have had a C-section, and after a C-section, they've gotten Tylenol, like over-the-counter Tylenol for a surgery, because they do not believe that Black women feel pain the same way that our white female counterparts. And if you don't believe me, I'm going to insert a clip.
Black people feel pain the same way as white people. The 2016 study showed that 50% of medical students and residents who were studied thought that Black people couldn't feel pain the same way because they had thicker skin or their nerves didn't work the same way. Where is this from? It's a holdover from the days of slavery when white people had to feel better about using slaves. Black people used to be operated on without anesthesia and were used in studies without their consent, so this was a convenient lie. To this day, Black people are less likely to get the same treatment in terms of pain medication. They're more likely to wait longer in the emergency room. They're less likely to be taken seriously. It's a holdover from the days of slavery. And in my field, this plays a huge role in the Black maternal and morbidity crisis. The call to action. Doctors.
And mind you, this study is from 2016. 2016. So in 2016, 50% of doctors do not believe that Black people feel pain. And now the person, RFK, who has been appointed whatever the fuck his job is, he thinks that, once again, Black people should not be on the same vaccine schedules because our immune systems are different. The older generation of white men have created a systemic problem for Black women. So yes, I want a Black woman in that room with me. Someone who understands that, no, my pain tolerance is not higher than white women. A lot of people have been misdiagnosed because medication, surgeries, a lot of things have been based on white men. So that's why a lot of times we get misdiagnosed. Our medication dosage takes forever to get regulated because the dosage is not made for us. And, I hate to put the blame on a woman. And this is why I have such a disdain for people like Candace Owens, who sit in these spaces with these people like Tucker Carlson, and they become these fucking mouthpieces, because she herself has sat on fucking Fox or whatever their little thing is and said, if I see a Black pilot, I'm automatically going to assume that they lower the standards for him to get here. Am I going to be safe? Because why would you as a Black woman automatically assume that about a Black person? We all know she's a grifter and she's going to do whatever it takes for the money. But if I see a Black woman in a prestigious place, I know she worked so fucking hard to be there. I know she had every odd stacked against her. You mean to tell me you really think these older white men who have been raised in racism with racist parents, who some of them are old enough to be alive during segregation, who don't see Black people as humans, is going to see a Black woman and say, you know what? Let me make it easier on her. When you take your exams, is there a test that they give to Black people and there a test that they give to white people? I'm sure there is a criteria to pass. Do they lower the criteria? And this is the thing that irritates me so much about these people. It's the way in which they lie so easily. So easily the lies just roll off of their tongue consistently, and it is so exhausting. It is so exhausting. Serena Williams have come out and talk about how she almost died after giving birth. The mortality rate for Black women is insane. And even when you have money, it means nothing if you are Black. Because they didn't believe her when she said what she was saying about what she was dealing with. And in 2025, it's still a fucking problem. Anybody that and it's just really irritating for people who of color. It starts to make you even question your, like, I mean, not me, because if anywhere I'm at, I deserved it. Actually, I should have got it a long time ago. But it's just such a slap in the fucking face. But this is America.
To be a doctor, you need to study very hard. It's difficult or it's rare for you to see a very short bypass course for you to be a doctor, like in a 6 months, 1 year, 2 year kind of course that will make you to be a doctor and a surgeon. I don't think I've not seen it. If you have, let me know. Highest you're gonna see is a nurse or a medical something, probably work in the lab or something. But for you to attend to patients or even perform surgery on patients, you need to pass through stages. So for you to be a woman that wants to be a surgeon, I can imagine how it's going to be tough for a woman to pass through those stages, because automatically they already see you as a failure. Now you're a woman, and not just a woman, you're a black woman. I feel like they will put in their extra effort, all their best, just to get to that position. Then one man is coming from nowhere saying that if I see a black woman as a surgeon, I believe that she's not qualified enough to be there. This just shows like extreme racism. The way the society is, women always do extra work just to get up there, especially if you're not doing that. If you have a man or you have somebody in a higher position, or you don't want to slip your way around it, you need to put in extra work and prove a lot of people wrong. If you can do that as a woman, as a black woman, it's just over the top, and that intimidates a lot of them. That intimidates a lot of people, and they just want to belittle your effort as if you cannot do anything. I don't think someone that is not qualified will be employed as a surgeon, a black woman as a surgeon in an hospital. I don't think so. I don't think so, because there is no privilege. She doesn't have privilege. She's a woman. And she's not just a woman, she's a black woman. So I don't think. There are a lot of privileges in the society. We are pretty privileged. We get white privilege. We get so many privilege. I don't think I've heard black privilege for things like this when it comes to employment, when it comes to working and handling lives. I don't think I've heard black women privilege. Most of the time, we are always talked back at. In fact, there's a video trending currently on TikTok now that I saw yesterday. They said black women are always angry. Black women are always angry. And people were saying that if you say black women are always angry, have you ever seen a black woman so angry that she unalived a lot of people? Have you ever seen a black woman so angry that she went to the school to shoot children in classes? Have you ever seen a black woman so angry that she does something very, deadly? Have you ever seen it? But they always say black women are always very angry. They're always very angry. They're always very angry. Da, 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 da. I don't think they don't even know what anger is, because if you're saying black women are always angry and you don't even see them do some certain things that angry people do just because you annoy them a little bit, then what are you saying that black women are angry? This shows that society generally, they have this side eye for a woman that is black. The fact that you're a black woman in society, if you're okay, you can take care of yourself, you're living well, they see you as a prostitute. Somebody is feeding you, somebody is taking care of you, somebody is paying your bills. You cannot afford all this kind of luxury without a man. If you're a black woman and you're living a luxury life, and there's another race that is showing their luxury life online, people are going to attack you as a black woman. There's always something about a black woman that they are not doing right. And I don't understand why the hatred is so much that I don't get it. The thing is just so much for you to think that if you see a black woman, women surgeon, you think that she's not qualified. So they will employ a black woman that is not qualified. With the way a lot of people are looking in total into a black woman. So you think, oh, she's not qualified, you'll just let her in. How now? It's not possible. Anyway, what is your take on this video? Let me know your thoughts down in the comment section. Respectfully, it's your girl Mara Davis, and thank you so much for tuning in. I hope you enjoyed this one. Please like, share, and subscribe. And yeah, I'll see you on my next video. Bye.